some people have larger tongues than others. Tongue can take up a lot of space in the throat and make it difficult for people to breathe at night and cause the sleep apnea.
Good afternoon, Dr. Stern. It is so great to be here with you today. Thank you so much for your time. Can you please tell us a little bit about BlueSleep?
Thank you for inviting me, and it's a pleasure to be here. I love talking about sleep. And, before I created BlueSleep about 15 years ago, I was a throat surgeon. And I became a sleep specialist when I realized that so many people suffered from poor sleep apnea especially, which is related to the throat. I realized that it was very hard to get diagnosed. It was very hard to find a sleep doctor. And I thought, let's make this easy. Let's use telemedicine. Let's use technology. Let's have people make an appointment online. Let's have them communicate through their phone or their computer with our medical staff. And let's use the best technology that we can ship to people's homes to diagnose their sleep apnea or their other sleep disorders. And, we started before COVID, but I must say that during COVID, when it was impossible to go to see a doctor in person, a lot of people found our services particularly useful. And we grew very quickly during COVID, and we learned a lot with what's the best way to ship devices? What's the best way to contact patients and make sure that they do their sleep test? What's the best way to follow up with them? We've grown over the past 8 years into, I'd say, probably one of the largest telemedicine sleep groups where people can make an appointment within an hour and can follow up with us from currently 9 states in the U.S. as well as in the United Kingdom.
What exactly is sleep apnea, and how would you explain it to someone who's never heard of it?
Sleep apnea is certainly a term that people have been hearing about more often these days, and I know that a lot of people don't know exactly what it is, but it's a sleep disorder, and sleep apnea means no breath while sleeping, and it's repeated interruptions of breathing when people are asleep, and since they're asleep, they usually don't know they have it.
So how can someone tell if they have sleep apnea?
So that's a very good question. And the answer is, in some cases, the bed partner of the person who has sleep apnea has noticed something unusual about the way their bed partner sleeps. And most of the time, people with sleep apnea have snoring that's quite loud, that tends to occur all night and is associated with pauses in breathing. So a lot of our patients will tell us that the reason they're consulting with us is that their bed partner has told them that they stop breathing while asleep, and they haven't noticed it.
What are the common signs or patterns that might show up in the day-to-day?
So for people that have sleep apnea, because they have interrupted sleep, because the interruptions in breathing interrupt with getting deep sleep and restorative sleep, frequently people with sleep apnea feel sleepy during the day. They feel that they haven't slept, they're unrested, feel unrested in the morning, fall asleep in the afternoon, have difficulty concentrating, have difficulty with memory, have mood issues, they're grumpy.
Could you tell me, what are some of the health consequences that happen when sleep apnea goes untreated?
One of the most common consequences of untreated sleep apnea is high blood pressure. High blood pressure has been shown to be caused by sleep apnea, and if you treat sleep apnea, you can control the blood pressure. You can get drops in blood pressure, in some cases without medication. It also leads to many other chronic diseases that are associated with high blood pressure: heart disease, strokes, diabetes, weight gain, etc.
So how does sleep apnea develop over time?
It develops over time as the body changes, as we age, as we gain weight, and that's because the throat can narrow as a result of weight gain. It can narrow at night as a result of less support of the tissues and the muscles in the throat. So it won't happen from one day to the next. It'll take time, and it can take 20, 30, 40 years.
Well, what are the most common causes of sleep apnea?
So remember, sleep apnea is caused by a narrowing of the throat. So anything that causes a narrowing of the throat can cause sleep apnea. It can be just the shape of the throat, the shape of the jaw, the size of the tongue, the size of the tonsils. In children, sleep apnea is caused by large tonsils in the vast majority of cases. In adults, that's less of a problem. In adults, it tends to be weight gain, which is common, But even if there is no weight gain, just the shape of the face, a smaller jaw, a smaller top jaw or lower jaw, the top jaw, the maxilla, the lower jaw, the mandible. If they're small, there's less room for breathing in the throat. Some people have larger tongues than others, and tongue can take up a lot of space in the throat and make it difficult for people to breathe at night and cause the sleep apnea. So I mentioned that children that have large tonsils have sleep apnea. There are some adults that still have large tonsils, and that is one of the causes of sleep apnea and snoring in adults. It's not that common, but it is one of the relatively easy curable treatments by removing the tonsils, for example.
So how do you diagnose sleep apnea?
So the way to formally diagnose sleep apnea is by doing a sleep test. There needs to be a medical situation where somebody is observing your sleep and determining that you stop breathing and that you stop breathing a certain number of times, and that as a result the oxygen in your blood has dropped or your brain has been aroused from sleep because of the difficulty sleeping. Now, that used to be done in hospitals, but now it's done with home sleep testing technology that just fits on your finger.
Oh, wow.
It connects to an app on your phone, and it sends us the information about whether or not you have sleep apnea. Super easy to diagnose. And you can sleep with it at home for multiple nights because your sleep apnea may not manifest itself.
Well, what are the treatments for sleep apnea?
So we talked a little bit about treatments in children where removing the tonsils can, in some cases, cure sleep apnea. In adults, most of the time, it's not that easy. It's different for everybody, really. If somebody has a very small jaw, in some cases, they need to have surgery to fix their jaw. But in most cases, it's techniques to try to keep the throat and the airway open at night when you're asleep. One of the ways to do that is with what's called a mandibular advancement device. It's a little mouth guard that's custom fit to the teeth.
Oh, wow.
Top and bottom are connected, and when it's placed in your mouth, it keeps the lower jaw forward, and it doesn't let the lower jaw drop. And as a result, it takes care of the sleep apnea and also takes care of the snoring.
Wow.
Very, very effective treatment. The other treatment a lot of people have heard about and kind of scary for a lot of people is called CPAP, continuous positive airway pressure. That's a mask that fits over the nose or under the nose or over the nose and mouth, connected to a little machine that blows air in the nose and throat. It keeps some pressure in the throat so that the throat doesn't collapse.
Mm-hmm.
We tend to use that for people that have very severe sleep apnea. They stop breathing more than 30 times an hour. But for others, the mouth guard is very effective, very easy to use, and it's a great treatment for snoring, which is very, very, very common.
Could you tell me, what are some lifestyle adjustments that someone can make if they have sleep apnea?
So in many cases, it's many, many years from the first symptom of sleep apnea to the time that as medical professionals we see the patients. And for patients that are going to wait those many, many years, I would suggest that you try some lifestyle adjustments that can help. For example, if you're overweight, losing weight may take care of the snoring and sleep apnea. If you like to have a drink every night, that will definitely make snoring and sleep apnea worse. Have the drink another time. Other adjustments are the position that you sleep in. So when you sleep on your back, the jaw tends to drop. That tends to narrow the throat and make sleep apnea worse and snoring worse. So sleeping on the side is definitely one of the lifestyle adjustments to make. There are other lifestyle adjustments like the type of food that you're eating, actually. If you eat very spicy food and you have a lot of acid reflux at night, the acid reflux can cause swelling of the throat, and that can cause snoring, and that can cause mild sleep apnea. Changing the diet can sometimes help.
How can digital tools like BetterSleep help with early detection of sleep apnea?
I think that sleep treatments changed when the first app was invented for sleep, and go back to 2008 and Apple. And suddenly people started getting information about their sleep, and they started becoming aware of the fact that they weren't sleeping well, and maybe that's why they were having all sorts of problems during the day, whether it was concentration, whether it was mood problems, whether it was performance, physical, mental performance. And I really credit sleep apps to the rise in awareness and the importance of good quality sleep. BetterSleep is actually detecting snoring. And snoring is one of the most common symptoms of sleep apnea. And if you have snoring that's significant, you really should have an evaluation for sleep apnea, as we had mentioned. We've used BetterSleep to help notify patients who snore that they may have sleep apnea. That's critical. How better way to reach so many people who may have an underlying disorder like sleep apnea, which can be a considerable medical problem.
A lot of our users at BetterSleep come to us for insomnia. Is there any type of relationship between insomnia and sleep apnea?
That's a great question. And absolutely there is. In fact, at least 30% of people who have sleep apnea also have insomnia. And there are two types of insomnia. There's what's called sleep onset insomnia, meaning getting into bed, can't fall asleep. There's another type of insomnia that's called sleep maintenance insomnia, meaning you fell asleep and then you woke up at 3 or 4 in the morning, wide awake, couldn't go back to sleep. And frequently people are calling that insomnia, but in many cases, it's actually sleep apnea, because you have to ask yourself the question, why did you wake up at 3 or 4 in the morning? And many times it's because you were struggling to breathe all night, your struggle became more difficult, oxygen in your blood dropped, your brain woke up. And your brain woke up and is not letting you go back to sleep again because it wants you to breathe. And so that is actually sleep apnea, but it's disguised as insomnia or vice versa. So very, very strong association between what people think is insomnia, but turns out to be sleep apnea.
What is one misconception about sleep apnea that you'd like to dispel?
Can I dispel more than one?
Sure.
Okay. So the first one is that sleep apnea is not a disorder of elderly men. It can affect children, as I had mentioned. It certainly affects women. It affects women in the 3rd trimester of pregnancy. They start snoring. They have sleep apnea. That can lead to problems with the baby, with delivery. So sleep apnea is a disorder that affects men and women of all ages. That's number one. I'd like to do another one. The other one is that diagnosing sleep apnea is as easy as getting a home sleep test, putting it on your finger, connecting it to an app, and getting the result. And I'm going to do a third one. And the third one is that the treatment does not have to necessarily be the CPAP mask, which a lot of people are afraid of. It can be the oral appliance that you just put in your mouth.
Can I ask a follow-up question there?
Sure.
Just can you talk to me about the cost of this and also insurance? I mean, is that a barrier to many?
So insurance is different in different parts of the world, in different countries, and insurance in the United States is different in every state.
Yeah.
Insurance coverage has the reputation of being pretty terrible in the U.S., except it does actually cover the treatments for sleep apnea, and it does cover home sleep testing. Home sleep testing has been covered by Medicare since 2008.
Wow.
And oral appliance therapy, like this one, is actually covered by medical insurance. So it won't be covered if you go see your dentist, because dentists don't really participate with medical insurance. But at BlueSleep, we're a medical team, and this is covered by insurance. It's not covered by insurance all over the world, but definitely it is in the U.S. So these are medical treatments as long as they're performed by medical staff that are covered by insurance.
That's incredible.
Yeah.
What advice would you have for someone who wants to start improving their sleep tonight?
Try to, by prioritizing your sleep time, try to get ready to go to sleep at, say, 10 p.m. or 11 p.m. You know, breathing while you're asleep is very important. So sometimes if people have chronic congestion of their nose, for example, and they get into bed, as soon as you lie down, that's going to get worse. You're going to have to breathe through your mouth, and that's going to make your night's sleep definitely worse. So having a decongested nose is really important. If your nose is always congested, you may need to see an ear, nose, and throat doctor who will help you out. But otherwise, again, having a decongested nose is important. Being able to fall asleep requires relaxation. There's not going to be any magic where you get into bed, you turn off the light, and by turning off the light, you're going to fall asleep. That's not going to happen. You have to already be relaxed. You have to be within your bedtime routine with mobile phones and with having laptop computers in your bed. It's usually not going to help you. Interestingly, the blue light from the phones truly will prevent your brain from producing melatonin, and melatonin is a hormone that makes you sleep. So, of course, stay away from the blue light of your phones. A lot of the phones have an orange filter that you can put on them or adjust. Lots of things you can do. Exercising not too close to bedtime can also help the quality of sleep. Think about what you've eaten. Don't eat a big meal. Don't eat too close to bedtime. Think about drinking alcohol. If you like alcohol, make sure that you don't drink it just before you go to sleep. Drinking even 1 or 2 glasses of alcohol can decrease the quality of the sleep that you're going to get. Caffeine keeps you awake. So it also stays in your body for a very long time. Try to avoid caffeine as you get closer to noon or 1 p.m. And if you like to nap, which is actually good for your health, try to avoid napping at least 3 or 4 hours before bedtime, or even 5 hours before bedtime. Why is napping good for your health? Lots of people have napped. Salvador Dali had an interesting way to nap. Nap a very, very short period of time by sitting in a chair like this, and he would have a saucer on the floor, and he would keep a spoon in his hand, and as soon as he fell asleep, the spoon would fall in the saucer, the noise would wake him up. And that's called the Salvador Dali nap, which was just a couple of minutes, and by chance, that's the amount of nap time that I need to feel refreshed if I get very sleepy. Short naps are better. If you're taking very long naps and you don't feel refreshed, you may have some underlying sleep disorder. But short naps, 20 minutes ideally, and usually not past 3 or 4 p.m. are very helpful. And they've been shown to increase cardiovascular health as well.
That's fantastic. Thank you so much for your time today, Dr. Stern. This was just such an insightful conversation.
A pleasure to be here.
Where can our listeners learn more about your work, Dr. Stern?
Probably go to BlueSleep.com or BlueSleep.uk, and we have lots of information on what we've done, the blogs, videos, some of the research that we've published in the peer-reviewed medical literature as well. If you have a question that doesn't have an answer on our website, just contact us at help@bluesleep.com, and I'll be happy to answer the questions.